Page 1. Introductory page. This page shows an image of an older man with white hair and glasses staring directly at the camera with a wide smile. On this page also has the Age UK Norwich logo with the slogan, "Let's change how we age," together with the 80 years young established 1945 logo. At the bottom of the image, it says, "Improving the quality of later life." In the right bottom corner, it says, "Our Impact 2023 to 2024, followed by a chapter grid with the number 4 highlighted in blue. Page 2. Our mission. The mission statement reads, "We want Norwich to be an age-friendly and inclusive city. This is more important than ever with our ageing population." The We Help By section lists 5 key areas of action, each accompanied by a relevant icon. Number 1. Targeting and tackling inequalities that reduce life expectancy and quality of life. Number 2. Being a champion for people over 50, listening and responding to the voices of residents and championing their cause to make improvements and maintain quality services. Number 3. Providing support and opportunities that enable people to live healthy and connected lives. Number 4. Advocating the use of age-friendly design principles, promoting the World Health Organization age-friendly principles in the design of city, county and service environments, working on things like transport, housing and community support. Number 5. Read our story so far at www.agefriendlynorwich.org. To the right of the Our Mission heading is the Age Friendly Norwich logo. At the bottom left of the document is the text Our Impact 2023 to 2024. On the bottom right is also the logo for Centre of Aging Better with the tagline, "Action today for all our tomorrows." Page 3. An image of an older man with a mobile phone to his ear, looking as if he is talking to someone whilst looking out of the window. Overlaying this image is a purple box with a text inside, "Tackling health inequalities, poverty and hardship." At the bottom of the image is the Age UK Norwich logo with the slogan, "Let's change how we age," together with a couple of arrows encouraging people to swipe to the side for the next slide. Page 4. White text overlays a purple background. This says, "Our support can be a lifeline to safety." The word lifeline is circled in blue. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 5. This page shows an image of one of our Age UK Norwich advisors giving support and information to a member of public. Overlaying this image is a purple box displaying lots of different statistics. The statistics tell us that 18,365 contacts were made via our advice line, web chats and emails. 3,540 social prescribing sessions and contacts were made. 2,536 contacts at community events were made, and 10,551 advice sessions and contacts tackling 6,723 issues were made. The Age UK Norwich logo is in the bottom left-hand corner with the slogan, "Let's change how we age." Page 6. This page shows a quote from Mark Hitchcock, the CEO at Norfolk Citizens Advice. The quote says, "We work with Age UK Norwich because there is a real, everyday evidence of not only helping people to live happier, healthier lives, but of finding new ways of working together. It's a smart, caring charity that doesn't take the easy options, and its commitment to drive should be celebrated. Together with this quote is the Citizens Advice Norfolk logo and the Norfolk Community Advice Network logo, together with a photo of Mark Hitchcock. Page 7. Advice and Advocacy. This page shows the breakdown of our advice themes in a pie chart. 22% health, care and disability, 52% money and welfare rights, 3% family, personal and bereavement, 4% legal advice and wills, 7% products, and 12% home and bills. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 8. Referrals. The text at the top of the page says, "We know we are trusted to help." Nearly 60% of our referrals come directly from residents or their family. This is followed by a chart. The y-axis shows the percentage of referrals, and the x-axis shows different areas where referrals have come from. 57% of referrals have come from self-referral and family. 19% of referrals have come from the VCSE sector. 15% of referrals have come from GP practices. 4% of referrals have come from the Norfolk County Council. 2% of referrals has come from Norfolk Community Health and Care Trust. 1% of referrals have come from the Norfolk and Norwich University Hospital. 1% of referrals has come from the Norfolk County Council. And 1% of referrals have come from other. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 9. General Inquiries. This page shows a pie chart of all of the inquiry themes that we receive. 68% money and welfare rights, 22% health, care and disability, 7% home and bills, advice and wills, and 3% legal advice and wills. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 10. This page shows a cluttered house. Overlaying this image is a purple box with the text, "We secured 2.87 million in unclaimed benefits or debt reduction." This increased figure reinforces our impact in RETA areas where residents' eligibility for welfare is higher and levels of disability more common due to health inequalities. The number 2.87 million is highlighted in a blue box. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 11. This page shows an older man grinning from cheek to cheek whilst holding a small child in his arms. Overlaying this image is a blue box showing us the quality adjusted life of 7.32 years. The quality adjusted life year is a measure of health outcome that combines both the length and quality of life, representing 1 year of life in perfect health. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 12. Social Prescribing. This page reads, "In collaboration with a number of other charities, we were part of the Norwich and Broadland Living Well team. We offered support with non-health issues such as financial advice, physical health, improving living conditions and reducing loneliness. We worked as a team with community health professionals and were based in local GP surgeries for easy accessibility and connectivity. Despite winning multiple awards for this service, due to the lack of funding, this service has now closed. Above this text is the Living Well Team Norwich and Broadland Social Prescribing logo, and beside it is certificates of the awards that we received, as well as a picture of the team receiving the awards. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 13. This page tells us that £10.3 thousand was used in emergency hardship grants. This figure is surrounded by a pie chart showing us the percentages of where money was most used. In order of most to least, the themes are food, cost of living, household items, heated throws, and transport. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 14. This page shows an older lady in a brown cardigan looking hopefully towards the camera. Overlaying this image is a blue box that says, "We handed out 286 winter packs with living essentials for the most vulnerable." The number 286 is highlighted with purple lines. Underneath this is an icon of a hand holding a bowl of food. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 15. Oasis, Older Adult Support and Information Service. This page tells us, providing our support at a place residents find familiar helps provide simpler access to our services and support. The Oasis service in Lowestoft is an Age UK Norwich, Citizens Advice East Suffolk and Access Community Trust initiative aimed at providing tailored support for older adults. It is focused on offering advice, information, and services that help older people manage the challenges they may face as they age, such as practical assistance. Support may include help with navigating benefits, housing issues, and accessing other local resources. Social inclusion. The service emphasizes reducing loneliness and isolation by connecting older people with community activities and social networks. Health and well-being support. Oasis offers help in accessing healthcare services, managing health conditions, and staying active. Behind this text is a picture of the Olive Centre. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 16. This page shows a quote from Emma Ratzer, MBE, CEO at Access. Emma says, "Age UK staff have been exploring the different issues raised by our clients who attend the Olive Centre. We've had 2,000 plus interactions during the pilot. Information has been displayed on site, and they've been engaging with clients informally to find out more about their needs. Access has a steering group of volunteers who drive forward areas of change and will help lead on embedding the work by Age UK. Our in-house lived experience forum visit monthly and undertake a survey that has been co-designed by our clients. This whole project has been developed in response to the needs of our clients who tell us that since the closure of Age UK Suffolk, there is a huge gap in service provision and a declining support network for later life." Underneath this quote is a photograph of Emma Ratzer together with the Access logo. Page 17. This image shows one of our Age UK Norwich advisors with a member of the Oasis Centre, providing information and advice. The client has provided a quote saying, "We had no idea of our benefit entitlement until speaking with you. Thank you so much. Being awarded attendance allowance is going to make such a difference to our lives. If we can do anything for you, just ask. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 18. Quality advice. At the top of this page, 4 logos appear. Advice Quality Standard logo, Quality of Information Signposting Standard logo, the Age UK Charity Quality Standard logo, and the FCA logo. Under these logos, there's 3 paragraphs in white on a purple background. This says, "We are a network partner of the national charity Age UK and have successfully achieved the Age UK Quality Standard. This certifies that our charity is well governed and managed, committed to ensuring the well-being and safety of older people, our staff, and volunteers. We have also obtained the Quality of Advice Standard and the Quality of Information and Signposting Standard. That includes assessment of our advice process, audits and case file evidence, and secret shopper inspections for due process and customer service. We are regulated by the Financial Conduct Authority for our debt advice and listed on the Fundraising Preference Service. We are registered with the Information Commissioner's Office with registration number Z812799. In the bottom left-hand corner is the Age UK Norwich logo with the slogan, "Let's change how we age." Page 19. Contact details. This page shows the contact information for Age UK Norwich. In the top left, a colourful abstract graphic is visible, featuring curved shapes in shades of green, blue, pink and orange. This is a segment of the Age UK Norwich logo. Below this graphic, the text, "For more information, please visit www.ageuknorwich.org.uk/about-us." Under the heading Contact Us is the phone number 01603 496 333, followed by our email address, inquiries@ageuknorwich.org.uk, followed by another web address, www.laterlifelearning.org.uk. Contact information for the Chief Executive Officer, Dan Skipper, is listed next, with his email showing dan.skipper@ageuknorwich.org.uk.